This is breaking news.
Mayor de Blasio is giving an update on the coronavirus pandemic in New York City. Let's listen in.
Partner sites with Somos, their clinics and practices, and that goes through December 31st only. So go out, get that booster, get that incentive. We know vaccination is the key, and we know boosters are particularly effective against Omicron. Our healthcare leaders have been abundantly clear about that. So that's the key. Get vaccinated, get your kids vaccinated, get that booster. But of course, testing is another part of the strategy that matters a lot. We're doubling down on testing. We're working hard to meet the real demand that's out there. I thank President Biden, who announced 500 million at-home tests that we sent around the country. We're going to get a lot of those. That's going to help a lot. But in the meantime, we're focused on what we can do right here with what we have. And so, announcement today, we're adding 7 additional city-run testing sites as of today. That will bring us up to 119 city-run locations, fixed sites and mobile, all around the 5 boroughs. To find a test location near you, go to nyc.gov/COVID test. Those locations, a lot of them do not have big lines, thankfully, and they're very good at getting you a quick turnaround time. So let's focus on that. Also, starting tomorrow, we will have 5 city mobile distribution sites handing out at-home rapid tests. And this is really important because we want to make sure, of course, for those who can go to one of the testing sites, get the PCR test. That's great, but we want to make sure more and more of the at-home tests are available as an alternative. We're starting to get a little more supply. We need a whole lot more, but we will have, starting tomorrow, 5 city mobile distribution sites solely for the purpose of handing out at-home tests for those who need them. Those locations will be around the city. They'll be posted shortly. We want to make sure testing goes well. There will be some lines, there's no doubt about it, particularly at the private sites. But our job is to minimize the lines at the city-run sites and at our partner sites, get you the best possible experience, get you the quickest possible results. A little bit later, we're going to hear from Dr. Katz. I think he's coming on in a few minutes, so we'll get him back to talk about some of the specifics of that. But so we focus, obviously, every day on the COVID crisis, on the challenge of Omicron and how we overcome it. And I'm very confident this city will overcome it. In fact, it looks like it's going to be a very brief period, intense and challenging, but very brief. And we have a lot of tools to fight back. So right now, COVID is in the front of our lives, it's in the front of our faces, it's what we're focused on. But we know the COVID era will end, and hopefully as early as 2022. If we do the right thing, if we get vaccinated, we know the COVID era will end. We have powerful tools we're using to get everyone vaccinated, like our private sector vaccine mandate starting on Monday. But as we think ahead to the COVID era ending, we're going to have to redouble our efforts in fighting an even bigger challenge in many ways, and that's the climate crisis. That is going to be a huge challenge for our future. It already is, and up ahead. So we want to speak about that. But I'm getting a signal. Is that a Dr. Katz signal? Dr. Katz is with us? Okay, so I'm going to hold. I want to talk about the climate situation in just a second. But let's go back on the point about ensuring with COVID, with Omicron, with testing, making sure that everyone who goes to a city site has a better experience, faster experience, good turnaround time on their tests. Dr. Mitch Katz, head of Health and Hospitals, has been working hard over the last few days to add reinforcements to improve the process. Let's hear from Dr. Katz with an update.
Yes, thank you so much, sir. And we so much appreciate that New Yorkers are going out and getting tested. That proves that New Yorkers want to be able to get through this pandemic without infecting family members and friends, that they're very considerate and want to make sure that they're safe and others are safe. We have, over the last few days, had some challenges in meeting the demand. So many people have come out for testing, and for a period of time, we did not have home test kits, which are a great way of making testing happen more quickly. But today, we are expanding hours on all our health and hospital sites from 7 a.m. to 7 p.m. We've been able to do that by going virtual for our ambulatory care visits so that I can then have nurses and other staff who work in our clinics be available in the testing areas to make the testing go much faster. We've also now acquired a sufficient number of testing kits so that we will be able to hand them out to people who feel comfortable going home and doing a test, and that will also keep our lines short. So we have plenty of testing capacity now in terms of our labs, and I think people will have a very different experience. So I want to add one other update about health and hospitals. For a temporary period, we are going to be tighter about restricting visitors. We've never gone back to our usual open visitation policy. In general, I'm a big believer that people should have visitors when they're in the hospital, and that those visitors should stay as long as they're able to. But we've had a recent outbreak in one of our hospitals that we think is related to visitors, not of course their fault. There's so much transmission going on right now in New York City because of Omicron. And so for a short while we get the situation under control, we're going to have limited visitation. We'll always make exceptions in extreme cases. Certainly every woman who is in labor will be able to bring someone with her. If it's an end-of-life hospice situation, of course, family members will be allowed to come. If there is a sick child, of course, parents will be allowed to stay with the child. But for a short time, in order to make sure that we don't cause more disease, we need to limit the number of visitors. Thank you, sir.
Thank you very much, Dr. Katz. Thank you for the update. Thank you for what you're doing to manage this situation. What you said was absolutely crucial for everyone to understand. We're going to make some adjustments to make sure that we can take care of people, to make sure that we get people the help they need. But this is going to be a brief period of time, a brief and intense period of time. But health and hospitals will make sure that they make the right adjustments. They've been through, if I could be blunt, they've been through a hell of a lot worse than this and managed to come through it very, very well. So that's an update in terms of making sure people can get quality testing, and also the other adjustments for making sure that care is there for anyone who needs it when they need it. Okay, let's go back where I was. As I was saying, you know, there is a day coming, and it's actually hopefully not too long. If we get enough people vaccinated, if we do the right thing, get enough people with boosters, the day is coming when the COVID era is behind us, and the big focus will necessarily be climate change. And we saw what happened with the tornadoes in the Midwest, in the South. We've seen the wildfires in the West. We've seen horrible flooding. We've seen hurricanes. We've seen so many things that tell us the impact of the climate crisis is growing, and we've got to do everything possible to address it. Today, New York City is going to make history. A bill that is the best example to the entire country, in fact, to the world, of making big changes quickly. We already have the toughest legislation in the country, the toughest laws in the country on buildings and emissions and limiting emissions from buildings. We are now adding a crucial new piece of law that will change things profoundly and quickly. What we're saying is we are banning oil and gas use in new buildings. Now, this will phase in over the next few years, but the bottom line is we're going to get buildings away from oil and gas, away from those fossil fuels, get them onto electricity, which is increasingly becoming renewable electricity. This is part of how we wean ourselves off fossil fuels once and for all. We are convinced this is going to have a major impact right here in this city, reducing emissions, improving health, because less pollution equals better health, but also setting an example that other cities, states, nations will follow. When New York City does something, it is felt all over the world. So all new buildings will be electric by 2027. No more use of fossil fuels on site, going electric. And we know this is one of the essential things we have to do to make the change. This follows on our mandates for buildings to reduce emissions. This follows on our efforts to divest from fossil fuel investments with our pension funds. It all comes together, and there's more to do, and I want you to hear from someone now who really is one of the founders of the movement to stop the climate crisis, and one of the people who has done the most to wake us up to the dangers of fossil fuels and the fact that we have to go in a radically different direction. My conversations with him were one of the things that inspired me to move for divestment of our pension funds. His voice matters a lot, and I want you to hear from him about what this new law today will mean here and all over the nation, all over the world. My pleasure to introduce the founder of 350.org, Bill McKibben.
Well, Mr. Mayor, what a pleasure to be with you and to say that everybody around the country is watching with great sympathy as New York tries to deal with the latest part of this COVID crisis. Thank you for your work there. And thank you so much for this ruling today. Look, this comes at just the right moment. What we've seen over the last 10 days makes it clear that we cannot count on the federal government to do what needs doing when it comes to climate change. The holdup of the Build Back Better bill is the perfect example of the way that the fossil fuel industry has too often managed to subvert sensible policy at a national level. So we're going to rely on the state and city levels and on our ability to influence financial systems. You played a big role in that when New York City divested from fossil fuel, and now the city is playing a huge role in this leadership about getting off of oil and gas. This is the perfect example of how great activism in communities, groups like We Act, New York Communities for Change, the 350 groups in New York, on and on and on, have worked with policymakers in city government to allow them to take very reasonable, very sensible, very straightforward action before anybody else. This ban on new hookups of gas into new buildings is really profound. The Economist estimates that about 40% of emissions come from buildings. So there's no way to tackle the climate crisis without, and of course, New York City is the place when we think of buildings in the world. The great towers of New York City are the first thing that come to everybody's mind. So it couldn't be a more symbolic or powerful thing. And it couldn't be a thing that will make more sense for New York City's future as a center of commerce. Most of the big companies in the world now have announced that they're in the process of moving towards zero emissions. That means they're not going to be able to locate their headquarters in buildings that are burning oil and gas. They're going to need precisely the kind of new buildings that New York City is talking about today. So on every measure, this is a very, very important step that will be emulated across the world, but begun in New York. Thank you very much.
Bill, thank you. And I want to say something. I want to ask you something. What I want to say is none of us could have gotten this far without your leadership, your personal leadership, and 350.org. You've really lit the path for so many of us. And I want to thank you from my heart for that. And Bill, a lot of people, including a lot of younger people, my kids' generation, worry it's too late. And I always say to people, even if we fear that, we can't give up. We don't exactly know what the future brings. We just understand how urgent the situation is. These kind of things can make a difference. I think it'd be really helpful for people to hear your perspective on why to keep fighting, even though we're hearing dire warnings.
Well, it's a very good question. Look, your kids in some ways are right. We're very late in the game and we're behind. It's not a good sign when the Arctic melts, you know. And we're not going to stop global warming. That, unfortunately, is off the menu at this point. But we can, we think, still stop it short of the place where it cuts civilizations off at the knees. In order to do that, we have to move with the kind of speed that New York is moving today. The scientists have told us that we need to cut emissions in half by 2030 if we're to meet the targets that we set in Paris. That's a huge job, and it's going to strain our abilities. But the good thing is that the scientists and engineers have cut the price of renewable energy to the point where it's the cheapest power on the planet. The only things now that are holding us back are a toxic combination of vested interest and inertia. And those are the two things that the city of New York is standing up to today. So no guarantees that we're going to win this fight. It's a timed test, and humans are not that great at timed tests always. But this is a good sign of precisely what we need to be doing everywhere. And of course, it begins in New York.
Thank you so much, Bill. And Bill, you know what? Every single thing you called on us to do could be done and has been done. I really want to emphasize this because as I am closing out my 8 years, pretty much everything we tried to do, someone said was impossible, whether it was pre-K for all or hundreds of thousands of affordable apartments, whatever it was. With the first response typically was, that can't be done, that's too much, that's too fast. But whether it was divestment or our building emissions law or this new law to get rid of oil and gas in our new buildings, they all actually could be done, and now we have to go even faster. So I just want to thank you, because I'm sure you heard a lot of doubting Thomases along the way, but you never stopped telling us, yes, si se puede, as they like to say. You always told us it could be done. So thank you for that, brother.
Thank you.
All right, everybody. The climate crisis demands urgency. And so even as I'll be signing a law later today, I'm going to be signing some executive orders now that really matter. I said we were going to sprint to the finish of our administration. There's going to be some further evidence of that, because the climate crisis is so powerfully clear at this point. We have to act right now. So we have 2 executive orders I'll be signing, and I also want to summarize some of the other actions we've taken, including in our most recent budget modification just a few weeks ago. First, a focus on solar power, wind power, and hydropower, increasing the supply for New York City. That means for our city government, we will be 100% clean energy powered by 2025. All the electricity we use in just the next few years will be clean energy, no fossil fuels, because now we have secured, including with the action we took with Hydro-Quebec, we have secured the solar power, the wind power, the solar, wind, and hydropower combined to get us to that goal. For the city as a whole, we now are on a pathway to clean energy, clean electricity that will power 2.5 million New York City homes each year. That's what we've set in place. That is now going to play out to make this a safer, cleaner city. A lot more has to come behind that, but it's a great step. Now, second point, the investments that we put in the budget include $420 million towards creating a fully green municipal fleet. We have a lot of vehicles. They have to all become electric. So we have now the most aggressive targets in the country for converting our vehicles to electric. We have sped up our previous goals because of the urgency. Every vehicle will eventually be electric, whether it's a school bus or a public safety vehicle or the cars that officials drive around in. And speaking of those officials, we are requiring those vehicles to be converted to electric in the very near term. And we also want to get away from SUVs once and for all. There are better alternatives available and more green alternatives available. That's where we need to go. Finally, as part of that latest budget, $4.6 billion over the next years to upgrade infrastructure in every part of the city to make sure that our city government continues to get greener and greener and greener and more able to address the climate crisis through our own actions. We have to model for the people of the city and for the whole world that it can be done and must be done. I'm going to sign these executive orders, and to make sure that all of these plans, all these pledges are followed through on, one of the actions I'm taking today is to appoint a chief decarbonization officer for the city of New York, a chief decarbonization officer who will be responsible for ensuring that these goals are met and, in fact, intensified at the first available moment, that every part of the city government is moving to reduce emissions and keep us on track to reduce our government emissions by 70% by 2030. We can do that. 70% reduction by 2030. We can do that. I think we'll even be able to do better if we act aggressively. So I'm going to sign these executive orders now. And one thing we are learning about the climate crisis, as soon as you achieve one change, immediately start on the next. All right, I want you to hear from someone who's been helping to lead the way, and she and her organization have done just extraordinary work at changing laws, changing approaches all over this country, but specifically here in New York State. I want you to hear from the president of the New York League of Conservation Voters, Julie Tai.
Good morning. This is indeed a very exciting morning that we have here. So thank you so much for inviting me to participate, Mayor. You know, we are glad to get a gift of clean energy and of climate leadership as we're approaching the holiday season. All of the work that you're making here to really fight climate change is really critical. We appreciate you putting all of this into executive orders of making sure that there's leadership with the idea of someone who's in charge of decarbonization. We're really excited about the investments you're making for cutting transportation pollution, which is the largest source of pollution outside of New York City in the state and the country. And unfortunately, they all too often disproportionately impact communities of color who are located close to highways and diesel depots. We're really excited about those investments. You're putting your money where your mouth is, and that's really, really important. I'm hoping you get some of the money from the federal infrastructure bill, and hopefully, as Bill McKibben said, we'll get the Build Back Better bill done and help move us along. And this really builds on the passage of Intro 455 earlier this year to ensure that all of our school buses in the city are moving to electric as well. So this is all very exciting. As we're thinking about and making all these commitments for moving our city government towards electrification of our buildings, of our cars, of our trucks, of our buses, really key to all of that is a clean grid. Right now, we know only 28% of all our power in New York is from renewables. Most of that is from hydropower in upstate New York. Our downstate grid is very dirty. It relies, about 3/4 of the power comes from polluting fossil fuel plants and disadvantaged communities and communities of color. We know that when Indian Point closed, the power in New York City actually got dirtier and more carbon intense. And while the state has passed a law that requires 70% renewable energy by 2030 and 100% clean energy by 2040, it doesn't say where it's going to go. And the commitment that you made to NYSERDA, to the state, really helped ensure that Governor Hochul would approve 2 projects, the Clean Path Project and the Champlain Hudson Power Express Project, to bring clean energy into New York City. You already talked about how many homes that would be enough to power, but that would help us avoid 77 million tons of greenhouse gas emissions over 15 years. And really critical, it's going to reduce our reliance on those dirty plants in neighborhoods that are overburdened by air pollution and improve public health. You know, really the commitments that you made to buy that power, to move New York City's operations to fully renewable, to buy that from the Tier 4 projects was really key to approval for all that. And we really appreciate that. We're excited. And we're happy to see all these things are committed in contracts and in executive orders. We look forward to seeing all these projects coming to fruition for clean energy, for clean buildings, for clean transportation, for a clean city, because in fact, we do need the leadership of New York City as we move forward. As Bill said, when the federal government doesn't act, it's up to the states and the cities to make that happen. And New York City, once again, is continuing to lead on that issue. So thank you so much.
Thank you, Julie. Thank you. And we are going to keep acting, and thank you for your great leadership as well. And I want to speak about one more important climate issue, but tease the fact that we're going to have a special guest on who can certainly, among other things, speak to the incredible victory of that infrastructure bill getting passed and the fact that we're going to keep fighting together for even more support from Washington on climate and so many other issues. But in the meantime, we're going to keep making things happen here in New York City, and our special guest also had a lot to do with the next topic I'm going to talk about for a moment, which is Governor's Island. Governor's Island, once upon a time, belonged to the federal government. I'm going to first talk about this, and then I want our senior senator to weigh in on a variety of things. But the fact is that Chuck Schumer and Jerry Nadler and other great leaders helped to make sure that Governor's Island became something that would be crucial to the future of the city. And the city took over Governor's Island. And originally, of course, what we experienced today, an amazing place to go, a beautiful place for families and recreation and history and culture, but now we're going to make it something so much more. And earlier in the year, we announced a global competition to make Governor's Island the climate research and action center, not just for the United States, but for the whole world. Because if there's any place that you should have a global headquarters, it's New York City. We're the capital of the world in so many ways. We have the United Nations. We have every community from all over the earth represented. And we are feeling, as one of the world's great coastal cities, the impact of climate change. We saw it with Hurricane Sandy, to say the least. We are the place that has the talent, the drive, the energy to create the climate solutions of the future, to build the consensus for them, to keep driving us forward. So we asked some of the greatest academic and research institutions around this country to join together and apply to run this new extraordinary center. This is an unprecedented effort to focus all our energies on fighting the climate crisis. We now have 4 finalists, and the final decision will be made in the next few months, but 4 finalists led by key academic institutions who want to take this project and make it great. I want to congratulate them today. First, CUNY and the New School. With other partners, thank you for that great application. MIT has come in with a powerful application. Northeastern University, Stony Brook University. We've got 4 applications that are all powerful, great partnerships. I want to thank each and every one of them. And I want them to know that this decision is coming very, very soon. And then we're going to start to make big changes with this center. The eyes of the world are going to be on Governor's Island. I want you to hear from an expert who has been also one of the real thinkers about how we address the climate crisis, who has studied the challenges but also the solutions. He's the former chief scientist and manager of the Climate and Air Program at the Environmental Defense Fund, and a professor of geosciences and international affairs, and also director of the Center for Policy Research, on Energy and the Environment at Princeton University. Wears a lot of hats. My great pleasure to introduce Dr. Michael Oppenheimer.
Thank you, Mayor. And by the way, I'm also a resident of New York City. And I'd like to thank you and the city for the ban on new natural gas uses and the other initiatives you just announced. The emphasis of the Climate Center, in particular its emphasis on adaptation to climate change, is unique. The need for this focus is underscored by the horrific experience this summer when people drowned in their own homes during the deluge from the remnants of Hurricane Ida. The 4 finalists named by you just now embody the expertise that encompasses a full range needed to understand and reduce climate risk to urban areas everywhere, not just New York City. Like climate change itself, their focus ranges from global to local, and from the emerging clean energy revolution to the supreme need to understand how to protect especially our most vulnerable citizens. So I'm very happy with this initiative, and I'm proud of my city for assuming this leadership role. Thank you.
Thank you. Let me tell you, you've been right there with us every step of the way. You are a proud New Yorker, I can tell. But you've really helped us as we've been formulating our policies and approaches. I really want to thank you for that. And this needs to be the global center, because Lord knows we do not have enough action yet in this world on the climate crisis. So thank you for being one of the people who's helping to make this happen.
Thank you, Mayor.
Now, I mentioned a special guest who's joined us now, and it's kind of amazing whether you talk about Governor's Island. Well, he made that happen. He made that part of New York City's future. Talk about the infrastructure bill. Well, he made that happen. What can be in the future in the Congress to address the crying needs of this city and this country? He's the guy who's going to have the biggest impact. How did we come out of the worst of the COVID crisis? Where did we get the help we needed? Where did we get the stimulus and the support to get back on our feet? He made it happen. So I want to honor him today. One of my last opportunities as mayor of this city. But I want to speak very personally first about Chuck Schumer, because the entire time I've known him, I've admired him. And I remember first seeing him at a town hall meeting in Kensington, Brooklyn. I was just out of college, had an apartment with a roommate, one of my college friends. We got an apartment in Kensington, and we went to a town hall meeting, and there was our local Congress member, Chuck Schumer. And I listened to him, and I was mesmerized. And we talked along the way. And I remember so vividly when he made the decision to run for U.S. Senate. It wasn't an easy decision, but none of us knew at the time how portentous that would be of the future in which he would become majority leader of the Senate and do so much good in the nation's greatest crisis in nearly 100 years. But what I think of very personally as well is just the humanity and decency of Chuck Schumer. If you look in the dictionary under the word mensch, you're going to see a picture of Chuck. His feet are on the ground. They've always been on the ground, no matter how high he soars, no matter what title. His feet are on the ground. He is grounded in his beloved Brooklyn. He's grounded by his impromptu bicycle trips all over our borough and our city. He's grounded by his perhaps less than iconic experience with the Madison High School basketball team, which he recounts frequently. And we remember, everyone, Madison High School, Brooklyn, cradle of United States senators. We can say that for sure. But Chuck started out against the odds, started out in public life, made an impact everywhere he's been, climbed and climbed and climbed, but always, always, always remembered where he came from. And there's no finer a public servant that this city has produced literally in our entire history. And I'm putting Chuck Schumer up in the pantheon with Franklin Delano Roosevelt and Fiorello LaGuardia, because he has met the moment. He has dealt with a crisis beyond any of our imagination. And if he weren't there, this country would not be able to get through what we've gotten through already. That is a guarantee. And this city was saved in so many ways by his action. So this is personal and emotional for me, but it's also, as the person has the honor of representing 8.8 million New Yorkers, this is something I hope and believe would bring about the greatest unanimity you've ever seen in this city. If there's someone who deserves the key to New York City, he's sitting right next to me now, and it's my pleasure to present this honor to Senator and Majority Leader Chuck Schumer.
Unmask for it.
You can unmask for this occasion.
Thank you, Mayor.
I believe you're vaccinated.
Thank you, I am. 3 times. Thank you, Mayor. Thank you.
Thank you, brother.
Well, thank you, Mayor, and it is truly an honor to receive this key to the city I love so dearly and have lived in my whole life. And on behalf of, I want to just thank my staff for all the years I've been, whether it's assemblyman, congressman, senator, now majority leader. I have been blessed with such a hardworking, dedicated, smart, diverse, compassionate staff. And all of the things we've been able to do in Washington or here at the local level, I couldn't do without them. And let me just say, New York is a labor of love for me. You know, my dad, as you know, who just passed away a few weeks ago, he had a junky little exterminating business. He hated his job. He would pace the floor Sunday nights at 2 a.m., but he never complained. And he taught us things not so much by preaching, but by example. And one of them is the greatest satisfaction you can have is helping other people. But another is, he said, you got to go, whatever profession you go into, whatever job you go, you got to love your work. That it's a blessing to be able to do that, something he never had in this junky little exterminating business. I wake up Monday mornings, no matter how big the challenge, raring to go. And what motivates me is New York. I just love this city. It's just such an amazing place, as you said, Mayor. I ride my bicycle all over, and I stop and I talk to people and I see things I've never seen before. It's just an amazing, amazing place. And so anytime New York's needed help, I've tried to be there with each crisis. When I got George Bush to commit $20 billion to New York City reluctantly after 9/11, although he stuck by his word. After the financial crisis, of course, Superstorm Sandy, and probably our greatest challenge was COVID, where we delivered, billions, hundreds of billions of dollars to New York and its institutions and helped bring things back. So I am honored to receive this key. I'm honored to be in the company of people like Spike Lee.
Doesn't get better than that.
The amazing Mets got it. One person I do want to mention, Ray Pfeiffer, who passed away, who had helped lead the charge to those who rushed to the tower to get the medical help, and he was there in Washington even when he was dying cancer. He's somebody I've looked up to, and he's received the key as well. So I'm honored to receive the key. I will never, ever stop fighting for New York. As long as I have air in my lungs, that's what I love to do. That's what gives me joy and satisfaction, the love of this the greatest city, as you mentioned, in the world.
Amen. Beautiful.
Oh, I have one more thing.
You must.
Yes. Now, we always try to help New York.
Please.
You know about this. So I'm sending a letter to FEMA today. I got the letter here somewhere. Here it is. Asking them for 100 new mobile testing locations. We need these locations across the city. Now, today they said they're sending 6. That ain't close to enough, given the magnitude of the crisis and what we need. I asked the federal government 2-3 weeks ago in one of my little Sunday press conferences to do this. Now COVID is raging, the variant is raging. We need these mobile testing sites. You see people lined up all in every part of the city waiting to be tested. We need testing. Testing is one of the best ways to beat this virus. So I hope that FEMA, I know you've joined me in asking for this, Mayor, but I hope that FEMA will send us this. This is the key, testing. And it can be done at mobile sites. It can be done. We need more self-tests sent to people's homes. They shouldn't charge them for it. We can beat this crisis if we're smart and right on the ground with all, with all the help we need right on the ground. We need these 100 mobile sites, and we need FEMA to do it ASAP, and that's what I'm going to be fighting for in the next day.
Well, you remember the old E.F. Hutton ads?
Yes.
You know, when E.F. Hutton talks, I think when you tell FEMA you need 100 testing sites, our chances of getting those testing sites just jumped up a bit.
Let's hope.
You know, they just jumped up. But listen, Senator, I think people have gone through so much, and I want to tell you, knowing you were there was one of the things that kept us all going. I mean it.
Thank you. Well,
knowing you were there, every time I called you, you responded, not just responded quickly and with passion about what could be done next. And you always went to bat for New York City, and your batting average is pretty damn good.
Thank you.
I always say it helps to have a majority leader come from your city.
Yes, first time ever. But let me just say, let me return the compliment. I cannot tell you how often the mayor called with so many requests, each one of them thought out, each one of them smart, each one of them careful. 917-833-29. I know his cell number by heart. He called so many times. I'm not giving you the last 2.
Hey, that's good. That's good.
But he's been always there fighting like a tiger for New York, and especially during crises. We probably talked at least once a day.
Yeah, we did. But it helped me and all my team to know you were there, but I think for everyday New Yorkers too, to look and always hear you at the front fighting for us, getting things done.
Well, thank you.
And Senator, I'm going to ask very broadly, because it's on the minds of everyone. Everyone, obviously, it was a tough week. We all felt let down.
Yep.
From certain things that happened in Washington, but I want to make it a positive. I know you enough to say ball game's never over if you're on the playing field. I think it would be great if you just spend a moment updating New Yorkers on how you're going to proceed.
So we had a caucus meeting, Zoom, last night, where just about everyone participated. And there was universal feeling that we are not giving up, that we are continuing the fight on two major fronts, both of which we need very badly. One, of course, is Build Back Better. And Joe Manchin was on the phone, and lots of our members made pleas to him to continue and negotiate, and he agreed to do that. The president said that the other day. BBB is so important to so many people in so many ways, including New York. We will fight until we get it. We will keep fighting. And the second thing we also agreed on is this, what they're trying to do in so many legislatures across the country on voting rights, taking away people's voting rights, redrawing the lines of the legislature in a jaundiced, political, and sometimes bigoted way. And we're going to move on that. That may mean we may have to change the rules because we won't get any support from the other side, but we're doing it. So we had a great discussion last night, and there was virtual unanimity that we should be moving forward on these fronts, and we're going to work hard to come to an agreement to get there.
Well, that is extraordinarily encouraging. And the fact that everyone's talking, but most especially the fact that you are helping everyone, because I've watched with incredible admiration. You have quite a flock there, Senator.
Yes, I do.
And yet you keep a warm and personal connection with each and every one, across the spectrum. And that gives me hope.
Thank you.
That gives me hope.
Thank you so much. Thank you for this great honor. I will treasure it because it symbolizes the place I love so much, New York.
And we love you back.
Thank you.
Thank you, Senator. All right, everyone, as we continue, every time we gather, we go over the indicators, and these both show us the good and the challenge like never before. The good, we've now passed 13 million vaccine doses from day one. 13 million times a New Yorker rolled up their sleeve and got a vaccination, and that number is growing rapidly. And remember, that $100 incentive to get the booster, we want people to take full advantage of that quickly. 13,011,904 doses to date. Number two, daily number of people admitted to New York City hospitals for suspected COVID-19. Today's report, 220 patients, confirmed positively 53.46%. Hospitalization rate per 100,000 New Yorkers is 2.21, and we're going to talk more, obviously, in the question and answer about this, but the good news is our hospitals are doing well, and we are seeing a very different reality than we saw in 2020. Many fewer people in ICUs, thank God. So even though we're seeing these higher numbers, we're able to sustain. The last number is staggering. New reported cases on a 7-day average. This is a number, of course, we've never seen, 10,991 cases. And that number probably continues to go up. But again, we don't take that lightly. It's very, very, very big challenge, but it looks like it'll be a very concentrated challenge for a few weeks. So far, continue to see some evidence that these are more mild cases, hospitals holding, but the key and the thing we can do about it, the thing that will make all the difference is vaccination. So it's going out, getting that booster, getting your child vaccinated. The private sector vaccine mandate coming into effect Monday, all of these things are going to help us fight back and limit the impact of Omicron for what looks to be the brief time it will be very, very much in our lives. Okay, a few words in Spanish, and the topic is on testing for COVID. Hacerse la prueba de COVID es una forma importante de mantenerse seguro. Hoy anunciamos aún más sitios de prueba, horarios extendidos y más personal. Queremos que la experiencia de la prueba y la vacuna sea lo más fácil posible para todos los neoyorquinos. With that, let's turn to our colleagues in the media. Please let me know the name and outlet of each journalist.
We'll now begin our Q&A. As a reminder, we're joined today by Dr. Choksi, by Dr. Katz, by Dr. Ted Long, the head of the Test and Trace Corps, by Ben Furness, the director of the Mayor's Office of Climate and Sustainability, and by Claire Newman, the president and CEO of the Trust for Governors Island. First question today goes to Juan Manuel from New York One.
Good morning, Mr. Mayor. How are you?
Good, Juan Manuel. How you doing?
Very good, thank you.
Feliz
The
Navidad.
last questions. Thank you very much. This might be the last questions I'm asking you while you are mayor of the city. So, given that only 22% of New York City electricity comes from renewable sources, how is it possible that New York City government will be 100% clean energy powered in just 4 years? I'm assuming you spoke about this with the mayor-elect. And what would you do about our dependence on fossil fuels if you become governor?
So two very different questions. And on the second one, I'll say I'll have more to say on all the issues affecting the state in the weeks ahead. But we're going to have to use very, very aggressive approaches to address climate change. What we've seen just these last days in our country is yet another urgent message. So I want to see the kinds of things that we've done here in New York City extended all over the state, and I want to see a lot more than that. We're going to have to be really tough to make sure we reduce building emissions, to get away from fossil fuel powered vehicles. We need to, everywhere we can, just speed the conversion aggressively. But again, there'll be an opportunity to say a lot more of that starting in the next few weeks. The way we know we can get to all green, all electric energy for city government by 2025. The reason we believe in it were the actions we've been taking now over years and the investments we've made. I'm going to turn to Ben Furness, who's the director of the Mayor's Office for Climate and Sustainability. But I think the simplest way to say it, Juan Manuel, we really moved heaven and earth, come to an agreement with Hydro-Quebec to make sure we would have that renewable power. And we've taken a lot of other actions to conserve power, to retrofit our buildings, to make all the pieces come together so we could do clean electricity as a future New York City government starting in 2025. Ben, you want to add to that?
That's exactly right, Mr. Mayor, and good morning. So because of our commitment to purchase clean electricity for New York City municipal needs, because of our partnership with the state, there'll be 2 new transmission lines that'll be built. The first of which is scheduled to be complete in 2025. So when that new transmission line that runs from New York City up into Quebec, it'll bring clean and renewable hydropower and wind power right into the 5 boroughs to help us get our electricity from clean and green renewable sources.
Excellent. Go ahead, Juan Manuel.
And on COVID, we know that the numbers are going up when it comes to infections in congregate shelters among the homeless population, also in among our jail population. Are you thinking of taking any measures like you did last year when it came to shelters and Rikers Island?
Well, look, we're always looking at the situation we're facing and always listening to the healthcare leaders and following what the information is telling us. But I want to emphasize it is a different scenario than what we faced in the past. Again, with what we're seeing so far in Omicron, intense surge, but less impact. And we also believe it'll be for a brief period of time. So that does not suggest doing things the way we did last year. It suggests a different game plan. We also have a hell of a lot more people vaccinated than we did when we went through the challenges last year. And that's the foundation of all things. The vaccination efforts continue in any kind of congregate setting, and obviously as well in our jails. In terms of our staffing in the jails, uniformed staff, 85% of uniformed staff now vaccinated. That number is going to go up. Constantly providing vaccination to folks who are incarcerated, obviously in a very different way. With homeless shelters, we're constantly providing vaccination as well. Employees are vaccinated now across the board. We're always offering to residents as well. So vaccination is the game changer and makes the difference. What I can say is the good news in terms of, even with the massive challenges, and I'll turn to Dr. Katz on this, that in our correction system, some immediate steps have been taken to help ease some of the impact here of this COVID surge. We have, of course, most importantly, reduced our jail population. It's down 700 people over the last few months. That's a big deal in the context of the overall population, and we're going to keep driving that down. And as of the information we got just in the last few hours, even though there has been a number of cases, there have not been hospitalizations. And that's what we're seeing in general, that this more mild impact, thank God, so far. More cases, but not resulting in the worst outcomes. In many cases, of course, not resulting in hospitalization. So that's what we're seeing. Dr. Katz, you want to talk about some of the measures you're taking in terms of the correction system?
Yes, thank you, sir. We have opened up another unit for inmates who are infected so that we can keep them isolated and try to limit the number of infections that occur. We are, of course, constantly increasing the vaccination rate among both the inmates and the staff who work at the jails. And as you said, sir, I've checked as of this morning, despite a major increase in infections, we have no hospitalizations. And when it comes to the jail population, we move people very quickly from the jail to the hospital if there are even a question, because we recognize that jails can be difficult places to monitor sick people. So it gives me great pleasure in this really awful time that at least so far we have no hospitalizations. Thank you, sir.
Thank you.
The next is James Ford from Pix 11.
And good morning, Mr. Mayor, and everyone on the call, and congratulations to Senator Schumer for getting the key to the city.
Amen. No one more worthy, James.
You said it, and I will ask the question. You and your healthcare team have said that at city-run COVID testing sites, the turnaround time for getting testing results is typically 36 hours or in many cases less. I'm just trying to figure out what hard evidence we have for that statement. How is it monitored? How does that get reported?
Okay, I'll turn to Dr. Long and say, obviously, stating the obvious, James, it does vary with time and demand. But clearly, when we say it, it's based on actual experience. And it also varies by location depending on demand. But what I think we can say safely is a lot of the biggest lines we've seen have been at private providers. They, of course, have to turn around and go to a lab and get the results. Health and Hospitals has much more ability to move staff around, to get results more quickly because of the way it's all structured. And now 119 sites this week between the fixed sites and the mobile sites. So strongly urge people to go to the nearest Health and Hospital site to get that test. Dr. Long, in terms of how you track and how you can confirm and what the latest turnaround times are, what do you got?
Yeah, thanks, James. It's a great question. So what we're doing now citywide is we are doing unprecedented levels of testing. We're doing nearly 170,000 tests in one day. Our previous record, James, had been 120,000 tests in one day. And over the last several days, we have noticed, because we track very closely the wait times, that the wait times have been getting longer for the turnaround at our city-run lab. It is still much faster than other labs, but what we're doing today is, by the end of the day today, making substantial operational changes to get us back to our constant goal of 24 hours. Thanks, James.
Thank you. Go ahead, James.
I appreciate that. And then on behalf of my colleague, Allison Caden, this question, can you and the health leaders on quarantine for vaccinated people? Is it wise, perhaps, to require a full quarantine now that Omicron is spreading among vaccinated New Yorkers? And what is Test and Trace specifically telling people about this?
A great question. I'll turn to Dr. Choksi and then anything that Dr. Katz or Dr. Long want to add. Let's state the obvious as the layman here, James, that we have an evolving dynamic We haven't seen anything quite like Omicron before. We also have a reconsideration happening in Washington of what the period of quarantine or isolation should be. So there's a lot of different things moving right now, and we will keep updating our approach accordingly. But I can tell you for the basic, if it begins with something as simple as if you're sick, stay home. If you test positive, separate from other folks. Those basics don't change. But how we approach it operationally, what the standard should be, that can change over time. Dr. Choksi, why don't you start with the latest?
Yes, sir. Thank you so much. And I appreciate your emphasizing the most important point, which is that anyone who tests positive does need to isolate. That is very important to help us break chains of transmission so that other people are not exposed during the period of an infectious period for a case. Now, our current isolation period is 10 days, and that includes whether you're fully vaccinated or unvaccinated. That's based on what we know about the duration with which someone is infectious. We are following the science carefully here and speaking with scientists around the world to figure out if it may be possible, at least for certain groups, to shorten the duration of that isolation period. For example, in some other countries, particularly to help with the healthcare workforce, they have modified the isolation period only for people who are fully vaccinated. We are not quite ready to take that step, but it is something that we're considering and deliberating on. So again, I just want to give a very clear message to the public, which is if you're feeling sick, very important to stay home. If you test positive, very important to isolate, and the current recommendation is to do so for 10 days.
Thank you, Dr. Katz. Anything to add?
I think Dr. Choksi has covered it very well. In the healthcare setting, there are some healthcare providers who are looking at shortening the duration for people who are positive because in healthcare settings, people are wearing N95 masks, which offer a much stronger protection. So I think everyone is trying to find the right balance between keeping people isolated, which prevents them from going to work, and potentially exposing others by having people leave too soon. And the science is still unclear on these issues. Thank you, sir.
Thank you. Dr. Long, anything to add?
Yeah, one note. The vaccine does work against every variant, including Omicron. It does provide protection. Therefore, if you're vaccinated and you're not symptomatic, wear a mask for 14 days, get tested at day 5 to know if you have COVID. That's clear guidance. Thank you, sir.
Thank you.
The next is Michael Gartland from the Daily News.
Good morning, Mr. Mayor. Thanks for taking my questions.
Good morning, Michael. How you doing?
I'm doing okay. Thanks for asking. So I wanted to ask you about these testing sites that the federal government is launching. Senator Schumer said it would be 6. When and where do you expect those sites to go up?
We're getting the final word literally in these next hours of exactly both locations and hours and the amount of personnel they'll have. We're certainly working with the federal government to target them to some places where we have particular need. So that's definitely going to help. I'm very excited these additional sites are coming. I want a hell of a lot more, obviously, both in terms of new sites, agree with Senator Schumer, more federal sites, and a hell of a lot more of that in-home testing with those kits coming. But in the meantime, of course, again, our mainstay is our now 119 city-sponsored sites. But we'll have much more detail that we'll put out with the federal government in the next few hours. Go ahead, Michael.
Thanks, Mr. Mayor. My second question has to do with solitary confinement or punitive segregation, as it's also known. I want to read to you something that the mayor-elect said yesterday. He said, "I wore a bulletproof vest for 22 years and protected the people of the city. And when you do that, then you have the right to question me on safety and public safety matters." This was in response to a letter more than a dozen council members put out pushing back on his plans as far as punitive segregation goes. And it seems to suggest, you know, as a former police officer, he has, you know, like a kind of monopoly on, well, at least some critics have said, on this issues of public safety. What do you make of that statement?
Well, first of all, I want to say I have a lot of respect, everyone knows it, for the mayor-elect. I'm working very, very closely with him on this transition. I think he brings extraordinary understanding from his experience as both a police officer and a police reformer. But I've also known him to be someone that always listens to different perspectives and works cooperatively with people. Fundamentally, what he and I have been trying to achieve is the same thing in terms of our correction system. We need a safe and secure environment for those who are incarcerated and those who work in the system. And at the same time, we have to get rid of the things that were part of our past that held us down and did not redeem people, but actually made the situation worse. We got to close Rikers Island. We got to go to modern, redemption-focused, rehabilitation-focused facilities. We got to get away from the approach to solitary confinement that bred mental health problems and conflict. And there is a way to isolate an inmate who has committed an offense, to isolate them from the general population, do it in a safe way, but do it without the excesses of the past. And that's exactly what we have been building. And I think there's actually a lot of common ground with the mayor-elect on that.
The next is Katie Honan from the city.
Hey, good morning, Mayor de Blasio. Can you hear me? How are you?
Good morning, Katie. You sound energized today. How are you?
I'm just trying, brother. I'm trying to stay up. I'm trying to stay positive. It's certainly difficult. My question, you know, is about where some of the testing sites are coming. You know, the joke is, can you give a key to the city to open some of these testing sites? I drove by a long line on Northern Boulevard today because the city shut down a site that had the capacity for hundreds. So what is the strategic plan on that? And additionally, you know, I know that there are some CBOs who will be giving out rapid tests and handing them out. Which centers, will there be a list of that? Because elected officials yesterday in Queens in particular said they had no idea where some of these at home and the K95s are going to be handed out. So will that be distributed so people know where to go?
Yeah, let me thank you for the question. And look, Queens is clearly a place where we need a lot more testing capacity, and we'll be focused on that, as will the federal government. But you add a couple of things there. I'm going to turn to Dr. Katz and Dr. Long. You know, one, making sure everyone knows about our testing sites, the 119. I want them to explain how we make that information available. Two, the initiative to hand out the test kits through the community-based organizations that we announced on Sunday. And then, of course, we're waiting on a big resupply. This is what we need to make everything work better, both from the private market and from the federal government. We want to get those kits in our hands, because then we can turn around and get them to people in a much faster manner. So in terms of how we're building out on these fronts, particular emphasis on Queens, Dr. Katz and Dr. Long.
Thank you, sir. Thanks for the question. I think the most important thing for listeners to know is that to go to our website. So we just went to look just this minute, and we have multiple testing sites where you can get a test within 30 minutes. The vast majority are currently running times under 1 hour. So we're going to keep expanding, even in those places where the wait might be an hour. You'll find that people will be handed a home test kit if they wish to not have to stand on that line. So we urge people to go to Health and Hospitals website and look at under test and trace, and you'll see in real time how long the line is at all of our sites, and be able to choose one that does not require waiting. And then we, on our side, we're watching the wait times, and we're constantly moving people and moving vans. We can't always, of course, know which sites people are going to go to on a particular day. So we do the same thing we ask people to do. We watch the site. We watch the length of time people have to wait. And if we see that a large number of people have gone to one site and have lengthened the line, then we send additional resources. Thank you, sir.
Thank you. Dr. Long.
Yes, thanks for the question, Katie. So to find where our 119 locations are today, go to nyc.gov/COVID test. On the interactive map, look for health and hospitals facilities, but you can also see what private facilities might be more convenient for you. Also underneath that is where all of our mobile locations are situated for that day, including for the next couple of days. Go to our Test and Trace Core website, part of the Health and Hospitals website, to see the wait times for our brick and mortar sites. As Dr. Katz said, we just counted 7 less than an hour, and actually the wait times are coming down at several of our sites, probably due to the fact that we bolstered the staff at our hospitals and Gotham Community Health Center sites. We also will be releasing information about the new distribution centers. There'll be 1 per borough. Each will give out 2,000 home tests tomorrow, just as an additional way to let everybody in every borough have access to home tests to meet them where they are if that's how you want to be tested. Then finally, our community-based organizations are the best at knowing where the home tests need to go. So we're giving them the home tests, and then we're going to work with them, and they're going to be the ones making that distribution. So we aren't announcing it as formally as the rest, because it's up to them to be active in their communities, and they're the experts in doing that. Thanks, Katie.
Thank you. Go ahead, Katie.
Thanks. And I know I'd asked this the other day, but I keep hearing from city employees who are very concerned with the lack of flexibility in the city's lack of a telework program or whatever telework policy. Very, in their words, and they've sent me the policy, you know, it seems like it's very difficult to take paid vacation leave or even sick leave if they're not exhibiting symptoms but believe they've been exposed. They've also expressed concern because commissioners of some agencies and supervisors have not been at work, but they have to be. So it feels like a little bit of a double standard within that. So do you want to address that? I know you have hundreds of thousands of city employees who at least according to what I'm hearing from them, very disappointed and frankly afraid of the working conditions that they have to work under without any flexibility on the part of the city and you.
Well, Katie, respectfully, I don't see it that way. I don't think those are the facts. I think we got a workforce that's 94% vaccinated. That is the single most important piece of the equation. We got very extensive health and safety measures in our workplaces. They've been working. I remember when we brought back the workforce in May, people said the sky would fall, and we brought back people full time, and they said the sky would fall, and the sky didn't fall, and it's not going to fall this time either. We care about our workforce a lot. That's why we provided a healthy environment, and that's why we mandated vaccination. And I don't agree that supervisors are not communicating and working with people. I think my experience is they are, and commissioners, of course, are doing everything they do. As in fact, a lot of commissioners are working extra hard to get to the end of this year and finish out a lot of work. So we have the tools. If someone gets a positive test, then they qualify, of course, for very generous sick leave. If they get a negative, they're negative. It's straightforward in that sense. But we need to keep this city running. And that is our responsibility as public servants. We need to keep this city running, and that's what we intend to do.
The next is Paul Leota from the Staten Island Advance.
Hey, good morning, Mr. Mayor. How you doing?
Good, Paul. How you doing?
I'm well, sir. Thank you. So regarding outages at for city workers, are there any departments that are currently of major concern, and what is being done to address staffing?
No, we have, obviously we've got some people out sick because of Omicron, but everything's functioning. I mean, this is a reality we're going to face for a few weeks. We're going to see a high number of people out sick for a brief period of time, and people will go through their 10 days, or as you heard, that number may even come down soon. But right now, if it's a 10-day period when people are out of commission, everyone comes off their 10 days, comes back online, and if others are getting sick, you know, we just keep moving. But everything is functioning. I mean, this is the beauty of this very strong, proud city government we have. Our agencies are doing a great job. Everything is functioning and moving forward, and we're going to get through this. We're going to get through this. It'll be a tough few weeks, but we're going to get through it. Go ahead, Paul.
Thank you for that, sir. And regarding our reporting at the NYC Stapleton development, we received some information that looks like stovetop gas could return as early as May. That would make it for a year's worth of outages for the residents at one of the buildings there. I'm just wondering if you're aware of this and what can be done to expedite the situation.
Well, we will today, my team will double back with the leadership of NYCHA. They've been dealing with this and some other very difficult circumstances because some of the buildings, by nature of their age or the fact that they never were rehabbed, it's amazing how this kind of problem is structural throughout a building and takes immense work to resolve. We all would think, oh, you know, flip a switch, put it back on. It's the exact opposite. These are very, very involved, complex projects to get things restored. But we wanted to go as fast as possible. Every resource is going to be made available. If there's anything NYCHA needs they don't have, we'll make it available to them. And obviously the coordination with utilities as well. So I'll have the team double back today with the NYCHA leadership and get you an update today. But I feel bad for the residents who are going through it. And the answer, the bigger answer, Paul, is we got to fix up all of our public housing buildings. We have a plan to do that, particularly with the RAD initiative started in the Obama administration. And that's working, but it's going to take real time to get more and more done. The thing we need the most is Build Back Better, because Build Back Better would include a huge amount of funding for New York City public housing so we could actually go to the root of these problems and fix these buildings on a vast scale. That's what we need the most to help folks in Staten Island and all over the city.
The next is Jimmy from the Wall Street Journal.
Guten Morgen, Bürgermeister. Wie geht es Ihnen?
Jimmy, you got range there, brother. Buenos dias to you.
Yeah. So my question is for the doctors. First question, what percentage of the COVID infections that have been confirmed in the past, say, 3 or 5 days have been among vaccinated people?
Dr. Choksi, I know you're an expert on this topic. What would you like to say?
Thank you so much, sir. Jimmy, I don't have a specific percentage that I can give you because it takes us time to do the match with vaccination status. But here's what I can tell you in terms of what we do know. Certainly before Omicron, the risk of both infection, but then particularly for severe disease, was significantly higher for unvaccinated people compared to vaccinated people. For cases, it was on the order of 7 times as high for unvaccinated people. For hospitalizations, on the order of 13 times as high. With Omicron, we do know and we do expect that there will be more infections among vaccinated people because of its greater ability to evade the immune system. However, what we're keeping the closest eye on is how that translates into disease, and particularly severe disease among vaccinated individuals. And as of now, we have not seen a major signal of that, although we continue to monitor it day by day. What that means is that the people who remain hospitalized are, a significant majority of them are unvaccinated, and that proportion increases when you look at patients who are in the intensive care units. So these are things that we will be following in the coming days and weeks, but that's what I can tell you about what we know right now.
Thank you. Go ahead, Jimmy.
Great, and this is a complete switch of topic, but I've been reporting about what changes are going to happen when Mayor-elect Adams takes over in the new year. And many business leaders, real estate developers in the city have talked about how they're encouraged by what they feel is an open line of communication with the incoming administration and the incoming mayor. And many of them told me that they felt that there was sort of an arm's length or frosty relationship with you. They point to sort of your opening inauguration speech, pointing to remarks you made about Mayor Bloomberg, et cetera, and the whole Tale of Two Cities rhetoric. So I'm wondering if you want to respond to that, and also if you have any thoughts about the best ways to engage New York's business leaders for Mayor-elect Adams, or reflections on how you've done it over the last 8 years.
Well, it's a big question, Jimmy. I appreciate it. Let me say first, in this crisis we've gone through these last couple of years, I've had a lot of conversations with a lot of business leaders, and they've been very productive, very collegial. I heard loud and clear the concerns of the business community, what it was going to take to get us through this and to keep people's livelihoods in place. And that's really what it came down to. You know, there was a long time there where we didn't know if there'd be stimulus or extended unemployment benefits or any of that stuff. And it really came down to trying to protect people's jobs and livelihoods. And I think there was a lot of common ground. There's a lot of common ground about how important it was to keep the city moving forward, but do it in a smart way, how important it was to have our schools open, how important it was to do everything we could to bring back our offices. And even with the most recent action, the private sector vaccine mandate, there's clearly some who like it more and some who like it less, but there's been a recognition that the government acting is so much better than putting the private sector in a position of having to act in isolation. So I think there's been, in these last couple of years, many instances where we came together and understood each other and worked well together. To your bigger point, there is a natural tension, of course. If you want to address inequality, as I do, as is core to my being, and not accept the status quo, that's going to make some people uncomfortable. I know a lot of business leaders, I know a lot of wealthy people who believe we need to change things and believe there's profound inequalities that are dangerous and unsustainable, and I know some who bluntly do not give much weight to that reality and don't pay attention to it enough. But to me, it is the necessary discussion, and I've had this conversation with some of those prominent business leaders, even in this country, and said if we don't address inequality, income inequality and all other forms of inequality, if we don't address it soon and sharply, we're going to be in a very dangerous place. The divisions we've seen before will only get worse. So I think some business leaders hear that, respect it. I think some are put off by it, but I'm not going to change who I am and what I believe we have to do. Also, I believe in taxing the wealthy on a much higher level. I believe the wealthy are not paying their fair share of taxes. I think there's actually some wealthy people who agree with that. That's obviously going to create some distance for some people, just saying that out loud and believing it to my core. But that said, Jimmy, on the reflective point, I will also take some real responsibility on myself. There were times where I could have been a better communicator, for sure. There are times when I realize I should have slowed down and brought people in the room or gotten people on the phone and talk things through some more. And I certainly think where I have good relationships with a lot of folks in the business community is where I did that, or more consciously. And where I have, less good relationships, it's where I didn't take that time as much as I should have. So that's a lesson I've learned for the future. And certainly during this crisis, during COVID, I found that dialogue has gone a long way. I'll give an obvious example. I mean, I had the honor of having Danny Meyer, Union Square Hospitality Group, as the chair of our Economic Development Corporation. He's a fantastic business leader, also a guy with a great social conscience. I asked him to come into government and help us deal with the COVID crisis. He's been great at that. But we've also had a constant dialogue. And we knew each other before, but not with the depth of the relationship we have now. And that dialogue has been healthy. And he's challenged me sometimes, but in a way that was really thoughtful and important. So going forward, I want to do more of that. With business leaders and with others.
We have time for two more for today. The next is Joe Anuda from Politico.
Hi, Mr. Mayor. How are you doing?
Good, Joe. How you been?
Not too bad. I was wondering if you could just provide some context on the announcements you made today. What is the current daily testing capacity in terms of number of tests for the current number of city sites? And then with the addition of the 7 new ones you plan to open, and if you know the 6 federal ones that are on their way, what will the new daily testing capacity be?
Really important question. I'm going to turn to Ted Long, or obviously if Mitch Katz wants to add as well. And I would also say to you, Joe, at the outset, this is evolving because as we talked about like a month ago, testing, we were getting less and less business and moving to more and more of a mobile approach. And obviously the emphasis was first and foremost vaccination. We've got to keep that focus on vaccination first, especially with our new booster incentive. That's where the most important impact will be. But now we're in just constant growth pattern with testing. We're going to build out as much as we possibly can for this intensive few weeks with Omicron. The big X factor for us will be the home test kits. If we get those in really big numbers really soon, that's going to relieve a huge amount of pressure on the test sites. But we're still not 100% sure how much we're going to get when, and that's the X factor here. But to your question, how much capacity per day can we do now, and what kind of build out we see in the short term? Ted, what do you got?
All right, thank you, sir. So, Joe, first question is, what's our overall citywide capacity? Instead of projecting a number for you, I'll give you what we've actually done as a city. So on December 15th, we did 168,490 PCR plus antigen tests. That's a new record for us. That's actually still counting. So it'll probably be north of 170,000 soon. That's above our previous record of 120,000. For our 119 sites, more than 30 of them are new sites. Among the more than 30 new sites that we've added since we started to build, that's going to give us an additional capacity of 24,600 tests per day. And that's on top of doing about that with our current doubled mobile fleet and our current brick and mortar sites that we've had. So we've been building substantially. We've already been doing double what we were doing 3 weeks ago, and we're going to have the capacity to double that again. I hope that answers your question.
So Ted, well, I'm going to ask it for clarity. We're obviously dealing with what we think will be a challenging few weeks, but where do you see our maximum going in the short term per day for these city sites? Daily maximum total, what are you seeing?
For our city sites, I would see our daily maximum total as being probably on the order of 40,000 tests per day. And I would say citywide, we've already reached around 170,000. I think we're going to reach around 180,000 if we haven't already. So city sites will be doing an important piece of that. But I do want to, you're bringing up a good point, just to say, across the city, our private hospitals, our private practices, our community health centers are doing really important work. We as a city want to make sure that we're offering testing equitably to every neighborhood. We have big numbers here, but more important than just the numbers is our approach to being guided by our communities. If it wasn't for that, we wouldn't be able to bring the equity in testing to the city that really makes New York City unique.
I'm pulling you back to numbers. 180,000 a day, all elements combined. And that's without including the home test kits that people could take with, correct?
Correct.
Okay, so I think to Joe's question, if we think city and others 180,000 a day, obviously we would like to see those home test kits cover thousands in the short term, ultimately tens of thousands of people a day on top of that. So I'm talking out loud with you, Ted, and doing our math live. I would assume when we get a really ample supply of home test kits, we could easily be up above 200,000 when you add them into the equation each day. Would you agree with that?
Absolutely.
Okay. Go ahead, Joe.
Thanks for the several follow-up questions on my behalf, Mr. Mayor. I appreciate that.
I'm like, I want adjunct status today. I want an ID card from Politico.
And I still get my second question. This is great.
Yes, you do.
I wanted to touch on something that Mike asked you earlier about the punitive segregation, solitary confinement. When Eric Adams was speaking the other day, I think in part he was responding to a letter that had been written by a group of incoming council members, essentially challenging his desire to use this form of, I guess, incarceration. And he basically said, look, there's a group of people, they're not really on the same page as me. In his mind, they're not trying to move the city forward. And so his response as mayor would be to sort of just ignore them and do what he's going to do. More than half of the incoming council signed that letter. So I'm wondering, as a progressive person who's been mayor for 8 years, and you have a little bit of experience in this, do you think that's an effective strategy when dealing with the city council, is to just ignore a large block of people when they don't agree with something you'd like to do?
Look, again, my entire experience with Eric Adams, now going back over a couple of decades, is he listens to people, he works with people. He put together a very broad coalition in his election, which I admired and I think is indicative of who he is and how he'll govern. I think one of the things that he was talking about was the fact that he hasn't even taken office, and he would prefer, and I relate to this, he would prefer folks to come to him and raise concerns and work with him, especially when he hasn't even gotten into office yet. So I think what you're going to find is he will work well with people. I think the impulse of those council members, I certainly accept that they with a full heart and in a way that they felt really reflected their values and concerns, they were saying, let's not go back to what was broken about solitary confinement. And I agree with them on that. But I also think we have to be respectful of the fact that a new mayor coming in wants people to try and work together and communicate and come to him and come to his team in a spirit of collegiality. And I think that's a fair concern he feels.
Last question for today goes to Yehudit from Borough Park 24 News.
Morning, Mr. Mayor. How are you?
I'm doing well, Yehudit. How are you?
Great, fantastic. So on Omicron, I feel like we're getting some mixed messages, and I'm wondering whether the physicians could please provide some clarity. On the one hand, everyone is, that you're saying and the doctors are saying this is not like what we went through in March 2020 because we have better tools, a high level of vaccination, and also that Omicron creates more mild cold symptoms. But yet, I feel like there's a certain level of hysteria that the Omicron variant accounts for 73% of all cases. And Dr. Katz said the other day he's preparing the hospitals for what could be a deluge of patients. But I'm wondering, of the 73 cases nationwide, how many are really sick or hospitalized, or how many just have mild symptoms? And I know that there's a lag time between infection and hospitalization, and that vaccination prevents against severe disease. But I'm wondering, based on what the doctors have seen in South Africa and other countries, I'm wondering whether Drs. Katz, Choksi, and Long can provide clarity on whether the cases of Omicron in New York City are, whether the cases are considered mild, even among the unvaccinated, and how many people hospitalized worldwide in the surge right now were vaccinated.
All right, now Yehudit, that was long and multi-part question, so we're going to try and boil that down a little. The first part I want to pull out of that is what's happening in our hospitals. You use the word, sort of the hype or whatever that's going on here. I want to emphasize, I think if we look at the facts, we look at the fact that this is profoundly different than 2020. This is really, really important. In 2020, we had a brand new, shocking reality of COVID. Now, after almost 2 years, our hospitals really do know how to handle COVID in so many ways better than before. We have vaccination on a vast level and growing. It is an entirely different reality. And Omicron is very different in its impact based on a lot of what we've seen so far. So we got to just keep reassuring people. I heard you say, you feel there's some mixed message. Well, I do think there's some whipping up of fear out there, but we're not doing that. We're doing the opposite. We're reassuring people because of the facts. And I'm going to start with Dr. Katz. And I think the most powerful fact is what's happening in his hospitals. Is he preparing for more cases? Sure. And there's going to be a brief and challenging time where we're going to have a lot more cases. But I think what's happening in his ICUs and how it compares to 2020 is the most pertinent story here. So Dr. Katz, could you speak to that?
Yes, thank you, sir. And I think you've gotten it very well. I think that what Yehuda, you're seeing as a mixed message is how people respond to the transparency of the data. What the data show are that cases are astronomically increasing, no question. Cases themselves, we've never seen as high levels. However, as the mayor has said, very sick people, no. The 11 hospitals of Health and Hospital currently have 54 patients in our ICUs due to COVID. That's compared to the peak in March 2020 where we had 970. And the 54 is compared to the lowest we got to, which was around 20. a few weeks ago. So very, very slight increases in the sickest of patients. We are seeing mild increases in people who need to come in for a few days of oxygen therapy. They generally don't need to be intubated. They don't need to be in the ICU. So cases, huge increase. ICU, tiny increase. People in the middle needing hospitalization, mild increase. A lot of the preparation that I'm working on is not because I'm worried about a deluge of sick patients. What I'm worried about is a large number of my own staff exposed to Omicron and therefore on 10-day isolations. That's already been happening, and to the extent that I lose these people, and we have to lose them in order for everybody's protection, that's the staffing problem that I'm worried about. But we continue to see mild disease. I think the implicit question you asked, is Omicron milder in the unvaccinated? I think that's an open question. I don't think that's yet known. There's just not enough data, at least that I feel comfortable being able to tell you. What I am comfortable saying is that among people who are vaccinated, which is most of New York City, the disease seems to be very mild. Thank you, sir.
Hey, and Ted, I'm going to just do a quick follow-up of my own. You did a great job yesterday explaining the virus and the nature of the virus. A lot of people said to me that was very, very helpful to hear. I want you to just take a piece of what you said about what's happening in the hospital. You mentioned to me the other day, when you don't have to intubate people, of course, what that means for their health and well-being, but also what it means for your staffing, because you're going to have people out for 10-day periods, and then they'll come back. But the other question is how much staff you need to handle the people you have and how the qualitative reality has changed. So could you talk about what it means, how many people you're intubating, and what it means that you're doing less, what it means for your staffing?
Yes, sir. Thank you. So if someone is on a ventilator, at most a highly trained intensive care nurse can take care of 2 patients on a ventilator. If patients are on a regular medical floor because they need oxygen but don't need a ventilator, then a nurse can take care of about 5 patients. And so it's the intubation people on ventilators who really drive the level of staffing. And so right now, again, I'm doing okay. We have enough staffing at all our hospitals. We are using overtime. We are bringing in registry staff as we need to, but not a crisis. We are doing well, and as long as we are still in a place where most people's disease is mild, we will not see anything like what we saw in March of 2020.
Amen. Go ahead, you hit it.
Okay, thank you. Just to represent the warriors of the world, I wanted to see how worried vaccinated should be. But then just to broach another subject that I worry about, in your last press conference in which you updated New Yorkers on crime, you celebrated the accomplishments of precision policing and neighborhood policing. Yet the NYPD revealed hate crime that went up a startling 97% in 2021 over 2020. And as always, the majority of those crimes, 179 out of 474, were aimed at the city's Jews. So I'm wondering, what do you think precision policing and neighborhood policing are not doing to prevent hate crimes that rose so dramatically this year?
Yeah, let me answer that, and then I'm actually going to just do extra credit on that question of what unvaccinated people should feel at this moment in the face of Omicron, because I want to give Dr. Katz an opportunity to really pound the point about how much more protection vaccination provides against Omicron. And I just think people need to hear that again. So I'm going to go back to him in 1 second. But on this point you raise, what we know is, and you and I have talked about this before, it's not just this horrible stretch we've been through with COVID and the interrelationship of that to an increase of crime for a period of time, including hate crimes. The problem of anti-Semitism is deep and intense around the entire world. And I always say, you know, some people had, unfortunately, the hope or the illusion that it was stamped out after World War II. In fact, it was only dormant in a lot of countries, in the West in particular, that acted like they were so civilized and so tolerant and so inclusive, but the anti-Semitism was bubbling right below the surface. And it now has manifested in many countries very deeply and dangerously. So that is, to me, the profound problem that we have to confront. We have to stamp out anti-Semitism in a really fundamental way, and that's going to take years of hard work. And I'm worried about the nativism. I'm worried about what we've seen the last few years in this country coming up that is bad news for Jewish people, for immigrants, for people of a variety of faiths and backgrounds. It's something we should be very concerned about and keep fighting. In the last couple of years, we have seen that uptick in hate crimes. It's unacceptable. I believe the combination of the government and the police standing strong with the community and other communities standing together with the Jewish community is the way to push that back, fight that back in the here and now. And I believe in consequences. Anyone who commits a hate crime, NYPD finds them, we hold them accountable. There needs to be serious penalties, serious outcomes. You do all of that, we will turn this. I really believe it. And we've seen upticks before, and we've seen how we fight them back and get them back down. That's what we got to do again, and I'm quite certain that's what we're going to do. And I think 2022 is going to be a better year, and we're going to come out of the COVID era, and that's going to help us a lot. Finishing, Dr. Katz, back to you. Hammer this nail, brother. If you're unvaccinated, the difference, if you're unvaccinated versus vaccinated in confronting Omicron.
Sir, huge difference, and thank you for giving me another opportunity to review with New Yorkers that overwhelmingly the patients who are in our ICU, who are on ventilators with COVID, are the unvaccinated. And just to sort of help to block misinformation, yes, many people know someone who is vaccinated and boosted who still got very sick. That's because some people are on immunosuppressive drugs or have an underlying immunodeficiency, which means that they do not develop the same level of antibodies when they get vaccinated. And so it's incumbent on all of the rest of us to help protect them by getting vaccinated so that we're not exposing them. And it's also why you and Dr. Chotsky put out a commissioner's note that people who are elderly, people who are immunosuppressed should skip optional activities right now because we know that they do not mount as robust a response. But even they are much safer with vaccination. It's not about cases. It's about keeping people out of the hospital, keeping people off ventilators, not allowing fellow New Yorkers to die. That's what we most care about, and vaccination is how we do that. Thank you, sir.
Thank you. Beautifully said, Dr. Katz, and thank you to you and all of our healthcare leaders who have been such powerful voices and so helpful to your fellow New Yorkers. I'm thankful for all of you, Dr. Katz, Dr. Chotsky, Dr. Long, and all your colleagues who have helped people through. And right now, this is our last scheduled press conference before Christmas. That obviously might change depending on current events. But I want to take this opportunity to just wish all New Yorkers very Merry Christmas, very happy holidays. Whatever your faith, whatever your background, we all belong here. We're all in this together. And whatever you're doing to celebrate or gather with family and friends, I just want to wish you a time of peace and joy. It's sad, it's really sad that we have this new worry with Omicron right when we were hoping to take a break from all this and just be with our loved ones. It's another stress on top of all the stresses we've been through. It's tough, it's very tough. But I'm just, even with that, I'm so appreciative. I'm so appreciative for all the people out there working every day to keep everyone safe. Thanks to all our healthcare heroes and our first responders, everyone who's vaccinating people, testing people. All these people care, and they are there for you. And even though we're going through that stress, and it just is such a weight. I am so grateful for the people who are helping each other and showing that love for their fellow New Yorkers, and I think that's something we should be inspired by. I think even as we wish we had a different dynamic here in our holidays, we're being reminded of the meaning of the holidays. We're being reminded of what all our traditions tell us, which is to love thy neighbor. And that's what New Yorkers are doing every single day to keep each other safe. So very Merry Christmas, very happy holidays to all, and we will see you again soon.